My name's David Hughes. I'm a nurse and I specialise in working with men after diagnosis of prostate cancer. One of the major issues that afflicts men having prostate cancer therapy of many types, including removal of the prostate, is incontinence. Incontinence is lack of control of the bladder after an operation, so that when you cough or sneeze or go to the pub and have a few beers, you can wet yourself, or you can have a continuous stream of wetness that would bother men for years, leading to either catheterisation or wearing pads of some type for a long period of time. One of our main goals, in fact our main goal, is to ensure this doesn't happen with men. The way we do this is by teaching pelvic floor muscle exercises as soon as you're aware that you have a prostate issue, and up to surgery or radiotherapy, and for long periods of time after that you would need to continue these exercises. The pelvic floor muscles themselves are located in the pelvis, obviously, below your bladder and around the prostate. They start at about your backbone and run all the way around to a bone in the front of your hip, your pelvis, called your symphysis pubis. They're a big sling of muscles that sit in your pelvis. They have a number of jobs that they do, but one of their major jobs is to support your bladder and to support the sphincter at the base of your bladder to ensure that it is able to close and stay closed to prevent wetness on an ongoing basis. These muscles are damaged during the course of surgery and will recover, but need to be built up and maintained in order that they will stay in good condition and keep you going for many years of dryness. There are a number of ways to do these, and a number of people discuss different ways. The way I'm going to show you is the way that the experts have shown me to do this. Now, there are a number of steps and stages to doing pelvic floor muscle exercises, so we'll start with the most basic to begin with. There are 3 steps that you would need to learn separately. Once you have learnt these 3 steps, you would need to put them together and do these as one exercise. Now, the exercise begins with the first exercise. Imagine that you've got a barrel full of wind and you're at a party and you just can't pass that wind, you have to hold on to it. So the first exercise is to close your backside sphincter and hold it for 5 seconds. You count to 5 and then release it. Now this must be done with as much vigour as possible, because muscles only work when they're contracting, so you need to contract this muscle, hold it as tightly as you can and release it. The second exercise is the area that you will see here between the back of your scrotum and your anus. This area of skin between your scrotum and your anus at the bottom of your pelvis is called your perineum. What you need to do is imagine that there's a red hot poker or a needle coming up towards that perineum, and you're lifting it up. You're sucking that perineum up and lifting it off the chair. Hold it up for 5 seconds and then relax. So the third exercise now is, imagine you're on the side of the road, you're having a wee, bus load of people come around the corner and you need to stop that wee and hold it for some reason. So that's the third exercise. Imagine you're having a wee, it's a great stream and you have to stop it and hold it for 5 seconds, so you clamp and hold for 5 seconds and then relax. Once you can do those 3 exercises, you would put them together as one exercise. So let's go over them again. First exercise is close your backside and hold it as tightly as you can. While that backside's closed, lifting that perineum up and holding that while your perineum's being lifted and your backside's closed. Clamp off your urine, all 3 together, hold for 5 seconds, 1,000, 2,000, 3,000, 4,000, 5,000, and relax. That's the way to do those exercises. Now you need to do those exercises 10 times in a row is one exercise. So I call it close, lift and clamp. Close your backside, lift your perineum, clamp your urine, hold for 5 seconds, relax. Do that 10 times in a row. That's one set of exercises. These exercises need to be done 10 times a day in the build-up and rehabilitation phases of your pelvic floor muscle exercises. So I teach these sitting down. It's not necessary to do these sitting down, but it's a great way to do it. It's a trigger. Your backside will hit the seat at least 10 to 15 times a day. It's a great visual and reminder that to do those exercises. So try it every time you sit down to do this exercise. Close your backside, lift that perineum and clamp. That's the best way to remember to do those exercises. Every time you sit down, ask your wife or partner to remind you, because there's one thing that women like more than shopping, it's telling men what to do. So try to get your wife involved in helping you to do these by reminding you every time you sit down to do these exercises. If there's something else you do 10 times a day, like playing golf or anything that you do 10 times a day, that's a great way to remember. I don't know of many things, so this is a great way to learn. What we're doing so far with pelvic floor muscle exercises is nothing particularly new or earth-shattering. What you're doing is when muscles contract, they exercise. When they relax, they're not exercising. You contract and hold and you relax. That's what you're doing at the moment. Imagine these are your bicep. You're contracting and holding these muscles and relaxing them. Contracting and holding and relaxing, which is a great way to start the pelvic floor muscle exercises. What we want to do now is build up on that to ensure that you get good strength in these pelvic floor muscle exercises. This is where you show fantastic results to achieve and maintain dryness over long periods of time and stress. What we have to do is add resistance. Just as I wanted to build up my arm, I would need to pick up some weights and lift and hold and release to get great extra muscle exercises out of that. If you can't put weights on your pelvic floor muscles, so the best way to do that is to put resistance. Imagine that instead of using weights, I'm lifting and holding and contracting and relaxing. Pushing down with my left hand into my right hand, I'm adding resistance, and the amount of exercise that I'm getting in this muscle is far superior to just relaxing and contracting. So we're going to try that now as our second step of our pelvic floor muscle exercises. What we're going to need to do this is to get down on the floor, and we're going to do some little crunches where your hands go behind your head and you lift up and you hold, and that way you're putting the extra stress and strain on those muscles. Pelvic floor muscles. As we were saying, we need to add resistance to these muscles in order that we get real strength. A great way to do that is to lay on the floor and do some little crunches, which are like mini sit-ups. That will put the strain in that you need to add the strength to these muscles. So this is the simple, easiest way to do it. Find yourself a nice comfortable spot, get your feet nice and comfortable, sitting flat on the floor, and get ready and then lay down. You're now on the floor. What we need is your feet flat on the floor, knees up in the air, hands cupped and behind your head with your elbows facing straight out. Get nice and comfortable, relax. You may need a mat or something like that next to your bed to do these. So, as I said before, all muscles are only working when they're contracted. So the first thing we're going to do is contract those pelvic floor muscle exercises, and then we're going to do little sit-ups, little crunches, where we slowly come up and we bend over from side to side. Now, because our muscles wrap around our body in three ways, we're going to do these exercises in three ways. First of all, we will come up and across to the left, then we will come straight up, and then we'll come up and across to the right. So the idea would be that as we come up, our right elbow comes across towards our left knee, then both elbows would come up towards both knees, or our left elbow up towards our right knee. It's not about speed, it's about stamina with these muscles. So take your time, take it easy, and only come up as far as you can. If you have a bad back or any other problems, take it nice and easy. What we're going to look at doing is 5 each, 3 times. That's 3 repetitions of 5 of these exercises in each direction. And this is how it goes. Close your backside, lift that perineum up, clamp off your urine so you've got a good strong contraction ready to go, and then imagine someone's going to punch you in the stomach and you need to brace. The 4th exercise is to brace your tummy and hold it. You're now ready. With those muscles contracted, you're ready to go. So close your backside, lift that perineum, clamp off urine, brace your tummy, and slowly come up and across. You would need to do 5 of these in that direction, and then relax. When you're ready to go again, have a deep breath, close your backside, lift up your perineum, clamp off your urine, brace. Now while they're being held, come up 5 times straight away. Easy, nice and straightforward. If you have troubles doing 5, relax and just hold for 5 seconds. So you could do the same exercise, and instead of going up and down 5 times, hold. This is the way you would do that. Close your backside, lift your perineum, clamp off your urine, and up you come, hold. 1,000, 2,000, 3,000, 4,000, 5,000, and relax. Let it all go.
Now you need to do 3 repetitions. So you would do 5, close your backside, lift, clamp, brace. 5 from right elbow to left knee. Then you do 5 straight up and 5 from left elbow across the right knee. You would do 3 repetitions of them, and you need to do them at least twice a day to 3 times a day. That then gives you that extra sustenance and strength that you're looking for, that enables those pelvic floor muscles to get super strong and support your bladder and your bladder sphincter in a way that will ensure that you get continence very, very quickly and very, very permanently.
A number of men that I see after they've had prostate cancer therapy complain about being dry most of the time. It's normal for men to get dry at night time fairly quickly, but during the day, a lot of men complain to me, especially down the track 6-12 months after therapy, that they're okay, they're wearing a pad still just for comfort or for security, but if they cough or sneeze or get tired, then they often just have a small accident and wet a bit. There is a great way to sort that problem out using pelvic floor muscles as well. The way we do this is against resistance, as we've already discussed. Every time you were to sit down, stand up, open a door, lift a box with a pumpkin in it or a bag of groceries, sneeze or cough, is the time that you're most likely going to wet a bit. So what we would do is the same pelvic floor muscle contraction that we've discussed just before you do any form of exercise that increases the stress on the top of your bladder. The way we do this is, as I've discussed, that close, lift and clamp prior to coughing or sneezing. It's that simple. So what you would do is close your backside, lift that perineum up, clamp off your urethra to stop your weeing, and then cough or sneeze or stand up and sit down or open that door. What you're doing is twofold here. The first thing you are doing by closing your backside, lifting that perineum and clamping off that sphincter is you're supporting the sphincter and the bladder to help hold them closed while you're coughing or sneezing or putting strain on that bladder. So you will stay dry as a result of that. Second to that, what you are doing is what you call an activity of daily living exercise. When we stand up or when we sit down, we put a lot of strain on the top of our bladder and these pelvic floor muscles, which is why we wet. When we cough or sneeze, we put a lot of strain on the top of that bladder, which is again why we wet. By closing, lifting and clamping off that pelvic floor muscle and then coughing, sneezing or lifting, we're maintaining the integrity of our bladder and those muscles by closing the sphincter off. At the same time, we're exercising that muscle against the stress of coughing, sneezing or lifting. So you have a twofold win on this one, that you stay drier and you exercise that muscle. That's a very important aspect of your pelvic floor muscle rehabilitation and ongoing maintenance, is that whenever you do anything that would strain that pelvic floor muscle, you would do this little close, lift and clamp exercise, and you'll find in no time at all that you build that muscle back up and get complete continence back again. Thank you for your time.